Next, it's really important to make sure you have transportation set up. This can be really challenging if you're planning for surgery like 3 years in advance, which is sometimes the wait lists are that long to kind of already have this in mind. But as you get closer, make sure that you have transportation arranged for multiple trips. Make sure your caregiver knows that they're going to be responsible for transporting you as well. For many surgeries, face, chest, and breast surgeries, it's very typical to plan for transportation with caregiver support for at least 4 visits. One the day before surgery, called your pre-op visit, one the day of surgery, one the very next day after surgery, and usually 1 week later after surgery. So a lot of times that's a minimum of 8 days. And it'll be very important that you stay within 30 minutes from your surgery center and from your surgeon during those 8 days at a very minimum, no matter what surgery you have. Some surgeons may be more okay and permissive with you going further away, but I just know I've heard too many stories. I've been with folks and I've learned from different folks, and they're like, I really wish I would have just stayed around. Because if a complication happens, your exact surgeon or somebody from their team is the best person to address that complication. So make sure that there's transportation during that time. And if you have a longer surgery where you need to stay in the area for a month, make sure that you know when appointments are, about how often they'll be, and that you have transportation for those visits. Also, make sure that you know what will be needed for transportation. Your surgeon's office can really provide you with more details. Most surgeons will not allow for public transportation. Some surgeons recommend hiring a specific cab service that works with them frequently. But just know that you, as a person who's undergoing surgery, will not be allowed to drive yourself anywhere after surgery. There's a lot of reasons for that. It is unsafe, number one. Number two, if you have any chest surgeries, moving your arm like that, not a great plan. And then you will likely still have anesthesia in your system, pain medicines, etc. So the surgical person, not allowed to drive yourself. And the surgeon should tell you how many weeks until you're allowed to drive as well. So in the meantime, your caregiver will really need to be responsible for the transportation. All right. You picked your surgery, you picked your surgeon, you're in the place where you need to, the location that you need to be. It's the night before surgery. Very, very important to be kind to yourself and to your stomach. Just because you traveled somewhere, this is not the time to be trying new food or the hottest spicy special that's going on. You really need to eat something bland for dinner the night before surgery. Don't drink alcohol the night before surgery. Don't eat or drink anything at least 8 hours before surgery. Usually the instructions say don't eat or drink anything after midnight. So nothing by mouth. NPO is the way that they'll say that. It means nothing per oral, nothing, you're not supposed to swallow anything at least 8 hours before a surgery where you're going to undergo anesthesia. So make sure that you follow these rules. They will cancel your surgery, actually, if you have some gum in your mouth when you show up that morning. They want nothing at all in the mouth. Why is it so important? Well, if you have something that's still in your stomach, you could regurgitate it. Or as it's going down, it could go down the wrong pipe, and that's called aspiration. So you could regurgitate it and then it could go in your lungs, or as it's going down, it can go in your lungs. When you're awake, you just are like, oh, it went down the wrong pipe, and can cough it out, and we're usually fine. But when you're asleep undergoing surgery, you're asleep and you have no cough reflex. And so it can be a medical emergency to aspirate or have food go down, or water or whatever it is, go down the wrong tubes, the wrong pipes. So they're very serious about making sure you follow that rule for your safety. Next thing is to really not shave any of the areas of your surgery unless you've been instructed to do so by your surgeon. This may not be applicable if you had hair removal, but specifically if somebody's like, oh, I'm gonna get, surgery that's on my chest or my breast, I should really, shave my armpits. When we shave, we introduce small openings in the skin, and that can increase the risk of infection. And so I would not do that unless your surgeons instruct you to do that. If there's hair where they need there to not be hair, they have a sterile razor that they can use in the operating room. So none of that. Remember to wash the body again with the special wash that if the surgeon prescribes something like this, betadine or Hibiclens. And if you're getting a genital surgery, many surgeons will have you do a bowel clean out. What the heck is a bowel clean out? Well, if you're an older person or a person who's had some issues, you'll have known what the heck that is because you've done a colonoscopy. So it's the prep for a colonoscopy, kind of same thing. They want to reduce the chance of infection. So they want to get all of the poop out of your body before surgery. And it is a whole process. So if, let's say you're going somewhere and you're having surgery out of town, but you need to do a bowel clean out, well, you need like 24 hours for that. So don't just think you're going to arrive and have surgery the next morning. You need a whole day to have the bowel clean out. And it's usually a big old jug of this powder that you mix with water, and it not always tastes good, usually tastes pretty terrible, and your stomach feels upset and you just have to keep drinking more and more, and then you have to be on the toilet for hours and hours and hours until you're pooping clear water out pretty much, and that's when you know that you've completed the bowel clean out. So that's a whole thing, and a lot of times people don't talk about it, but make sure you know if you need to do this, and also that your caregiver is around so that they can support you during this. Sometimes people throw up during the bowel clean out as well, so just know it's, you know, it's not this easy thing to do. The morning of surgery, wash the areas they tell you with the special wash, if that's what your surgeon recommends. This is not the time to look cute when you're going to the surgery center. So casual, loose-fitting clothing, something that's easy to put back on, such as a shirt that buttons up or zips up the front, especially if you're having chest surgeries where you're not going to be able to lift up your arms for them to put a shirt on you. So a robe, something easy. No skinny jeans. People will have to help you put your clothes back on after surgery if you're going home after that. So you want to make their life easier, not harder. Thick socks are important. These places are usually really cold, and some sort of slip-on shoes or slippers is really going to be the best bet as you're going in for surgery. If you're staying in the hospital after surgery, then you'll usually just wear the hospital robes, those sorts of things. All right. So next is do not wear any jewelry when you show up. No body piercings, no makeup, none of that. And be sure to mention if you have any dermal piercings or piercings that you can't take out to your pre-op nurse before the morning of surgery so that you have a plan for those. Some surgeons will let you put in kind of a placeholder. Others will not, because you can't guarantee that it's sterile, and they want their whole body sterile. What does sterile mean? No bacteria on it, if at all possible, is the idea. No lotions, no creams, no perfumes, no deodorants on the morning of surgery. That can be really hard, especially if you have sort of like your morning plan or whatnot. You got to not do those things because that can increase the risk of infection. You can brush your teeth. You can rinse out your mouth, but do not swallow. No gum, mints, or candy. That's that really important piece there. So the way I think of this is a lot of instructions. It's easier to think about, okay, prepare to show up to the operating room table the same way you originally came into this world. Naked, you haven't eaten anything through your mouth, no deodorant on you, etc. So that's usually how I instruct folks to think about getting ready to go in for surgery. If you take any medications, be sure to ask your surgeon and your primary care doctor if you should or should not take your medications that morning, or if you're on a blood thinner, if you're on different things, make sure you know exactly how to manage your medications in the context of undergoing surgery. Your support person. Do you see how this is in capitals and bolded? Probably super important. You need somebody with you for at least 72 hours. This is most specific to outpatient surgery, which means you have surgery and then you go to a hotel or to your home afterwards. Because if you have surgery and then you go to the hospital, you'll have a nurse with you at all times. So less applicable there. But if you are having outpatient surgery, when your support person picks you up, I want them to, or whoever it is, or if there's a couple of them, I want a body with you that's responsible for at least 3 days. The timing of complications is most common right after surgery. And this is when you're going to need the most help with managing your medications. If you have catheters or drains coming out of you that need to be taken care of, feeding you, watering you, bathing you, all of that, you need somebody with you. So have them stay with you at all times for at least 3 days after surgery. After that, then they can go run errands. So that probably means you should run errands before and get food and like all sorts of things ready to go before the day of surgery. So this is so important that your caregiver and you work together to make plans for this. Depending on the surgery you have, it's really best to have folks around to help you recover for at least 2 to 6 weeks. If you're having major surgery or genital surgery and you need to be in that area for 4 weeks, then you should have somebody that's with you for 4 weeks to help you manage everything. And then when you go home, at least 2 weeks after that. And so at least somebody coming in every day and checking on you, I think is going to be very important for an absolute minimum of 2 weeks, no matter which surgery you have. And so it takes a village. So make sure you have your village of folks ready to support you. Post-operative instructions. These are really immediately after surgery. It's really what you need to do is really going to depend on if you are in a hospital setting, so an inpatient setting, or outpatient. That means you have outpatient surgery. So you had surgery in the surgery center and then you went out, right? And so that's outpatient surgery. Inpatient is you had surgery and then you stayed in the hospital. So depending on what your situation is, that's going to kind of make a difference in terms of what your instructions are. So start with outpatient surgery. So this is when your caregiver drops you off for surgery and picks you up after surgery. When they pick you up, caregivers, you need to make sure you know what all bandages, drains, tubes, catheters coming out of that patient are, and what you're supposed to do to take care of them. And if you're not a medical person, this is even more important. But even if you are a medical person, I still want you to stop before you take them home and make sure you see all that's on their body and make sure that somebody has clearly explained the steps of what you need to do with everything. Because I don't want you to go home and be like, I didn't even know you had this wound vacuum, or like whatever it is on the particular patient. That should not happen, but you know what I mean. Also in bold, the caregiver, do not take the patient home until you feel confident, you know what all is on them and coming off of them and what you're supposed to do with it. I cannot overstate this. This is about that point that we made before about the importance of having low stress after surgery. If you go home and you're like, oh my gosh, am I supposed to empty this out? Am I supposed to keep track of how much I emptied out and what color it was? And how often am I supposed to change this? And what supplies do I need? That all increases stress, and caregiver stress can stress out the patient, and patient stress can stress out the caregiver, and it's just a mess. So make sure that you feel very clear with what all is happening and what number you can call after hours and during hours and on the weekends if a question comes up. After inpatient surgery, usually a member of your surgery team will come and check on you after surgery, and every single morning. You might not even remember that they came in because it was so early. They woke you up, they asked you a few questions, they checked on you, and they were out of the room. But that is very standard that they'll be coming in to check on you every morning. Your nursing team should be able to work with you and provide help, make sure you get your medicines, eat, those sorts of things. If you can have your caregiver with you, it's important that they observe how the nurses take care of you and how they change your dressings, because they'll have to do many of those same things for you without the nurse when you're discharged from the hospital. So having them be able to be there with you can be very helpful in preparing them to take care of you after you get out of the hospital.